Can kidney disease actually be reversed? If you've been told you have chronic kidney disease, you've probably heard two completely different answers. One says kidney damage is permanent. The other says you can reverse it with the right diet, supplement, or lifestyle change. So which one is true? I'm a certified nephrology nurse, and I've spent almost 30 years caring for people with kidney disease. And the answer is more hopeful than you might think. But we need to be very clear about what the word reversed actually means. Because damaged kidney tissue usually doesn't grow back, but kidney function can improve. In fact, researchers have documented sustained improvement in people with chronic kidney disease. We'll talk more about that today, but don't forget to hit that like button. It tells me you appreciate this type of content. So in this video, I'm going to explain what can improve, what usually cannot, how to know whether your kidney numbers are really getting better, and what gives you the best chance of changing where your kidney disease is headed. So, can chronic kidney disease actually be reversed? First, we need to define what we mean with reversed, because this is where a lot of the confusion begins. Chronic kidney disease means your kidneys have had an abnormality in their structure or function for more than 3 months. Inside each kidneys are hundreds of thousands of tiny filtering units called nephrons, your kidney cells. When some of those filters are permanently damaged and replaced by scar tissue, we don't currently have a treatment that simply makes that scar disappear and gives you brand new nephrons. So, if by reversing you mean erase all of the damage and make the kidneys exactly as they were before, then generally no. But that's not the end of the story, because there's another meaning of improvement that matters much more in real life. Your kidneys may be able to filter better. Protein leaking into your urine may decrease. Your kidney function may stabilize instead of continuing to decline. And in some people, the improvement can be significant and sustained. Researchers actually have a word for this: CKD regression. So when someone tells you, my kidney disease got better, they may be absolutely right. We just need to understand what got better. And that brings us to the question that confuses almost everybody. If the damage is still there, how can your kidney numbers improve? Let's start with eGFR, estimated glomerular filtration rate. Your eGFR is an estimate of how well your kidneys are filtering your blood. Most commonly is calculated using the amount of creatinine in your blood, along with things like your age and sex. But here's something I really want you to understand. Your eGFR is not a photograph of your kidneys. If your eGFR goes from 45 to 55, the lab isn't showing us that scar tissue disappeared or that new kidney filters grew. It's telling us that your estimated filtering function is better than it was before. And those are two different things. Kidney function can change for many reasons: dehydration, an acute illness, certain medications, a urinary blockage, changes in blood flow to the kidneys, even normal biological and laboratory variation can affect the number. Some of those things are temporary and reversible. For example, someone may have chronic kidney disease and then become severely dehydrated from vomiting or diarrhea. Their creatinine rises and their eGFR drops. Once the dehydration is corrected, the eGFR may come back up. Did their chronic kidney disease suddenly reverse? No, a temporary stress on the kidneys improved. That's why one good or one bad eGFR result doesn't tell us the whole story. This is actually why I created my free kidney lab companion guide. It gives you a place to track your eGFR, creatinine, and other important kidney labs over time. So instead of looking at one number and wondering what it means, you can start seeing the pattern. I'll put the free download in the description below, because with kidney disease, the trend tells us more than one isolated result. So now you may be asking, how do I know if my kidneys are really getting better? This is where we stop looking at one lab result and start looking at the trajectory. Remember, chronic kidney disease itself is defined by abnormalities that persist for more than 3 months. So, we are interested in what happens over time. And eGFR isn't the only number that matters. There's another test I wish more people with kidney disease knew about: the urine albumin-to-creatinine ratio, or uACR. That's the urine test that tells us whether albumin, a type of protein, is leaking through the kidney filters. Healthy filters are supposed to keep that protein in your bloodstream. When they're damaged, protein can leak into the urine. So think about these as two different pieces of information. eGFR asks, how well are my kidneys filtering? uARC asks, are my kidneys filters leaking protein? We want to watch both. And this is where the research gets really interesting. In a large Canadian study of more than 129,000 adults with newly identified chronic kidney disease, researchers didn't call one better blood test regression. They required kidney function to improve into a better category, improve by at least 25%, and stay there for more than 3 months. And sustained regression really did happen. Depending on the severity and age group, roughly 12 to 22% experienced regression during the 5-year study. So CKD does not always follow a perfect straight line downward. Some people progress, some people remain stable, and some genuinely improve. That's very different from saying we've found a cure for chronic kidney disease. But it's also very different from saying there's nothing you can do. So, what gives you the best chance of improving or protecting your kidney function? This is where the cause of your kidney disease matters. If something reversible is putting extra stress on your kidneys, a medication that's affecting kidney function, dehydration, an obstruction, an acute illness, correcting that problem may allow kidney function to improve. With chronic conditions like diabetes and high blood pressure, the goal is different. We're trying to stop or reduce the ongoing damage. That means getting your blood pressure under good control. If you have diabetes, managing your blood sugar, reducing protein leakage in the urine when possible, avoiding things that can cause additional kidney injury, including unnecessary use of NSAID pain relievers such as ibuprofen and naproxen. And depending on your individual situation, there are medications your healthcare provider may recommend that don't just treat blood pressure or diabetes. They can also protect your kidneys and slow the progression of CKD. This is why I don't want you chasing a food, tea, supplement, or anything promising to reverse kidney disease. Treat the reason your kidneys are being damaged. Protect the kidney function you still have, and follow the trend of your lab results. That's where the evidence is. So again, can kidney disease be reversed? If you're asking whether we can erase established kidney scarring and make chronically damaged kidneys brand new again, generally, no. But if you're asking whether kidney function can improve, whether protein leakage can decrease, whether CKD can stabilize, and whether you can change the direction your kidney health is heading, yes, that can happen. And that's the part I don't want you to miss. If high blood sugar or diabetes is one of the things putting your kidneys at risk, Watch this video next because I explain exactly what happens to your kidneys when you quit added sugar for 30 days and what starts changing much sooner than you might expect. I'll see you there.